Listen up, my fellow LGBTQ+A community. Did you know that March the 21st through the 25th is dedicated to our health? Yes, it's our 20th National LGBTQ+A Health Awareness Week. Today I have with me Frances, who's going to help me tell you what the Awareness Week means.
Hi, my name is Frances. I work here at a stable in the Nurturing Families program. This week is time for us to share with our community about what health that look like for those with little not trust in the healthcare system due to fear of being stigmatized.
Yeah, the health needs of the LGBTQ+A community is important as the heterosexual community and may even be a little more in need of being addressed. Today we would like to talk to you about the importance of seeking health care, no matter what community an individual associates themselves with, and provide the tools that they may need necessary to feel empowered. So, Frances, let's talk about your story.
So I don't really have a story that I've been afraid of look to a health provider. I do have a fear of my gynecologist just because she's a woman like me. And I have this fear that maybe she can tell me that something is going on there, or something wrong or something, other thing. So for me, I talked with her about my fear and she explained me that that's normal. She's gonna help. She is a doctor. And yeah, for me, the the way for being a good communicator with her, I explain how I feel, and she just resolved my problem.
Okay. Yeah, I know for me, mine was a little different. I had, I prefer a woman doctor.
Yeah?
Yeah, because from my childhood, I prefer a woman doctor. How about that?
Okay, all right.
So I will seek out a woman doctor because to me, I feel like they have a little bit more empathy.
Oh, yeah.
A little more understanding.
Okay.
And as a gay male, I can talk more with a woman quicker than I could with a straight man or even a gay man that's a doctor. I'd rather still have a woman doctor.
Oh, okay.
Yeah. So there's always different ways of
definitely.
But you just gotta be comfortable and know that you're feeling okay enough to talk to them and walk out free of that stigma. Because that's the most important thing is the stigma.
Yeah, definitely. It's important to discuss with your provider, your health provider, to your fears about, and they're gonna help you to find out a solution. I think. Yeah.
And if you can't find a doctor, you can always talk to your friends. You can look up LGBTQ friendly doctors. You know, there's always someone that will be able to help you find that doctor that you may need.
That's right.
You know, thank you for sharing, Frances.
Of course.
I would like to take the time to introduce my next guest, Latera, who is part of our LGBTQ+A community, and ask about her experience with trust levels when seeking medical attention.
Thank you, Keith. My name is Latera Massey. I am a family support provider here at Staywell Health. And I would just like to share with you an experience that I know my wife goes through when she goes to get her health care. And it's sort of different than me. My wife is known as what they call an aggressive female. She wears male clothing, so she feels really uncomfortable when she goes for her health care because she feels they look at her differently as if she's not a female. And when she goes for her gynecologist appointments or when she goes for her regular checkups, she often likes me to be accompanied with her to make her feel comfortable, which I don't feel should be because all individuals should be treated as that. And healthcare is a place where you should feel comfortable and able to be yourself without being stigmatized because you are of the LGBTQ community. I myself do not run into that issue because I am what most consider a femme. I dress like a female. I am a female, so most don't know that I am in the LGBTQ community unless I share this with them. So I have witnessed the differences in getting health care and getting the attention that's needed. And I also have a close person to me who experienced uncomfortableness, which is something we want to get away from. So remember, no matter who you are or what your health needs are, you should be respected and feel comfortable with getting the care.
Now, I can't let you go without telling you that everyone's health care is not the same. If your doctor thinks that, I think it's time for you to find a new doctor who understands your specific needs. Someone who is in a committed relationship is going to have different needs than someone who is single and in the dating world. So make sure you seek a provider who is willing to treat you for who you are. So thank you for joining us today. We hope you've been empowered to advocate for your health. If you are ready, call me at 203-756-8021 and I will be able to help you make your first step. Until next time, stay well.